Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. I'm Makhyan Jibril, cardiologist, and I'll be the host for the Asmiha Corner 2024. And today we have a very special guest from the USA, Dr. Hadley Wilson. Good morning, doctors.
Good morning.
How are you today?
I'm glad to be here. Doing very well.
Yes.
This is an exciting conference and a lot of people here.
Yeah, we're also very happy to have you today. Yeah. So you took for how many hours your flight from US to Indonesia?
2 flights, but about 20 hours.
20 hours. So yeah,
I'm from the East Coast.
Oh, yeah. East Coast, yeah. We really appreciate your time. Yeah, you need to take 20 hours to come here. So, guys, today we'll discuss about the trials that have been led by Dr. Hadley, which is ISCHEMIA trials, right?
Yes.
Yeah. Can you tell us more about this trial?
Sure. So it's actually not a new trial or new results. It was actually first published in 2018. But really what has happened since then is there have been so many subsequent follow-up on this large patient group who had stable ischemic heart disease or chronic coronary syndrome, or what you might normally call stable angina. And now what we know is we've been following these patients for about 7 years, and actually the final report will be in 2026, which will be about 10 years of follow-up. And there's some interesting findings that are coming from this, which are that it initially appeared that patients who were invasively treated with PCI or coronary bypass surgery did no better than those who were medically treated, except in a couple of groups. And that were those with left main, or those with heart failure or reduced ejection fraction less than 35%. Now it's also appearing that there's a possible signal that in patients who are invasively treated with anatomic severity with proximal LAD or three-vessel disease, that they may actually do better with an invasive management with surgery or PCI. And actually, we really won't know the full answer until the whole 10 years are reported in 2026.
Exactly. But I think doing the research for 10 years consecutively is very challenging things. You need to manage a very good team, and you need to manage the patient as well. So what's your strategy? How you manage to maintain your team in the 10 years research?
Well, so actually, I mean, the main investigators are Judy Hoagman and David Marin, and they've established an incredible network and of multiple centers, and they've been able to stay in touch with these patients amazingly well. And so there's been very little fallout or people who have left the study. So, I mean, this was initially over 5,000 patients, 2,500 in each group. And still, even now, I mean, there's, I think, about over 2,000 in each group still that are continuing to be followed. And again, some of those, were lost to follow-up, and some actually did not survive as well. So it's been incredible follow-up, and I think the 10-year results will be very important to finally answer whether or not doing invasive therapy, which is a PCI or coronary bypass surgery, is better long-term for survival for patients who have chronic coronary artery disease.
Yeah, and what's your expectation? I mean, I think some of the results already they've been there, right? Yeah, before the final result will be published in 2026. And do you think that the result will be a game changer for the our current treatment for the cardiovascular diseases?
So I think it will make it more clear who are the patients that need to be treated. I think those that just have angina and it's not involving either the left main or the proximal left anterior descending, the so-called widowmaker, those patients will need to be treated, I suspect, with surgery or PCI. But the others, the other vessels, the circumflex, the right coronary, distal LAD, they can probably be managed medically.
True.
So that, in that sense, it is a game changer.
It's a very game changer research. And last thing, you do have a message for us cardiologists and also the young researchers who will maybe follow your step to be a researcher in the cardiology field.
Sure. I'm happy to see so many young cardiologists and residents and fellows here as well. And I think, just follow your passion, your enthusiasm. I think if you do what you like to do and you feel that it's interesting to you, then you will do well in that area. So I would encourage that you have research experience, try and find a good mentor.
Yes, of course. Good mentor is definitely
And
very
a
important.
good program. How do you find a good mentor? Well, you ask your friends, you ask people that are a year or two ahead of you, and you find those people that you feel like will help your career along.
Okay. Yeah, finding mentors. And now today I found you as mentors as well. So guys, thank you very much for today, and see you next year in the Asmiha 34. Bye bye.